Penn's May 2026 seminar. We're proud to offer this content through our Amethyst at Penn Hub, which stands for Achieving Maternal Empowerment and Transforming Health Through Implementation Science and Training. Funding for this hub comes from the NIH's Improve initiative, which aims to reduce maternal mortality, improve pregnancy, perinatal, and postpartum care, and to address the factors that have led to severe disparities in outcomes for marginalized groups. As a reminder, we will be recording this discussion. It will be available on our YouTube channel for review after this session. Please feel free to put any questions in the chat. We'll also have some time for questions at the end. This month, we're fortunate to have Nicole Thomas from the REACH team to speak with us. I know Andrew Belfiglio is here with us as well, so thank you both. They are here to speak with us about building authentic academic community research partnerships and lessons they've learned from the Community Scholars Model. Nicole Thomas is the director of the Penn Medicine Center for Health Justice and the Urban Health Lab, and together Dr. Solomon and Dr. Thomas co-direct REACH, which stands for Research and Equity in Academic Community Partnerships for Health. Thank you so much for being here. Thank you for being here, Andrew. So with that, I will turn it over. You are muted. Nicole, you're muted.
I'm so sorry.
There you go.
Hi, everyone. Sorry about that. I just wanted to introduce myself. Thank you, Casey, for that introduction. As you mentioned, I have my colleague Andrew Belfiglio, who's also here and help build these two programs. So very pleased to be able to share our work with you. And we will be talking about how we really went about building this community scholars model and by extension, the REACH initiative. My background, just a little bit about me. I am a lifelong resident of West and Southwest Philadelphia. For those of you who are not familiar with the area, these are the communities that neighbor the University of Pennsylvania. I come from a family of community activists who, my grandmother in particular, were strong proponents and opponents of the university, depending on the issues that had surfaced in the various moments starting in the 60s and until her passing a few months ago. So here's our team. Sarah Solomon, who could not be here with us today. She's an implementation scientist. And Andrew is our director of communications and data analytics. So today we'll talk a little bit about community academic partnerships, just a little bit of background, and then move into talking about how we built the Community Scholars Program and some of the success stories that have come through that program, and how we built upon the Community Scholars Program to create the REACH initiative and what we're doing now, which is embedding this model within Amethyst to serve community partners within the Improve network. And then we have a few discussion questions, and I'm happy to answer any questions that you may have along the way. I can't see you all, so if you have a question, someone please feel free to sort of give me a nudge. So just starting off framing wise, what is partnership? So when we think about partnership, we think about these different sort of this continuum, as I'm sure many of you have heard about, of engagement. So we think about things such as outreach as like the activities that you may conduct to reach people, to recruit research participants, to share information about a study, even share data with the community. Input is really inviting organizations in to provide feedback on the research and activities. And sometimes community advisory boards are really focused on the input and then moving toward collaboration as an example. So this is where it typically happens starting earlier in the process, where the organizations or community members actually work closely with the academic team to make decisions. And then there's partnership. So we think about partnership as that deep engagement where the organizations are involved throughout the process, even at the point at which the research study is being formulated and designed. And so individuals are also included in decision making around what to study, what those research questions will be, how the study will be conducted, et cetera. And then all the way through dissemination and action if you're thinking about like community-based participatory research. Again, framing. So we've looked at PCORI's 6 foundational expectations for partnerships and research. This again may be something that's familiar to many of you, but I wanted to take a moment to highlight representative involvement, which we just talked about quite a bit, is really essential to this framework. Early and ongoing engagement, where community partners may be involved in grant writing, and throughout. There's dedicated funds for engagement and partner compensation. I get a lot of questions about compensation. Should we pay? How much should we pay? All of those sorts of questions come up quite a bit. I'm sure this is something, if you haven't encountered, you will encounter at some point. And then you really want to focus on building capacity, the capacity to work as a team. So really strengthening the skills and removing barriers for all partners. And oftentimes this piece focuses on building the skills and capacity and removing barriers for community partners, but not so much for academics. So you want to pay attention to all team members involved. We want to make sure that there's meaningful inclusion of the partners and decision making. So power is something that's really important to me. I focus my dissertation on power specifically in community academic partnerships. And so decision making, sharing in those roles, and which is leads to control and power sharing, really is important to ensure that there's a good foundation for the partnership. And then ongoing review and assessment of engagement. This is where many, according to the literature, many of those who practice community academic practice and community academic partnerships sort of fall short with how to and how regularly they should be assessing their engagement so that it's kind of like any other system. You want to ensure that there's quality improvements along the way. So that's one thing I just want to highlight there. So partnership really does start at the beginning, and doing things like from the beginning and planning, setting agendas, shaping the questions in the first place, how you conduct the research, the recruitment, data collection, guidance. Community members are really essential in helping to understand the nuances of community landscapes and how to really, reach those individuals, especially when you're trying to reach individuals that are not as easily accessible. And then analysis, so the interpretation of results. I think this is really important for folks because it's just a lens that we all bring, a unique lens. When we're thinking about what those data are telling us, I think it's very important to have everyone at the table. And then dissemination, both into academic audiences and to non-academic audiences, is really important. So co-presenting how you message, what you message, the formats that you use, thinking about things such as co-authorship. And of course, this is not an exhaustive list. I'll say a little bit, actually, I'll pause here for a second just to say a little bit about myself. So I started at the University of Pennsylvania originally in 2004. So I've been around quite a while. And I do remember coming in not having any research or health-related background. My background is in business, banking, finance, and workforce development. And so it was like amazing to me to see, understand, and learn about this research machine. But I do remember being viewed as a community member when I first started at Penn. And in some instances, not being invited to like meetings with statisticians or epidemiologists, like really getting into the science of it. It was sort of initially that, maybe I should just be part of the analysis, well, the interpretation of the data, but not really understanding the value of having a community member at the table throughout the process in some instances. And I think over time, I worked for the chief of geriatrics at the time, Dr. Jerry Johnson, who had a lot of community-based programming and a lot of community partnerships. We were able to build a coalition of community members that started to change that narrative and how folks viewed communities. So I think it really is important to define what the roles are, because strong partnerships really do require shared expectations. So starting with those guiding principles, what are our values? Even MOUs can help with this, really articulating what the roles, responsibilities, and the desired outcomes are for all partners involved is really important up front. And I say this in particular, I can think of an example of years ago, I was a part of the Philadelphia Collaborative Violence Prevention Center, which was funded through the CDC. And it was a CHOP center, but it was a collaboration for multiple academic institutions in this coalition that we had created of community members. And I remember there being like a dispute. We just didn't agree on a direction of some of the work. And one of the things that kept our study going was that our shared expectations and shared agreement included a guiding principle, which was that no matter what happened, we agreed to stay at the table and work it out. And I can tell you at least twice saved our partnership, at least for some of the friction that I think could have really blown up and impacted the research that we were doing. But community partners also deserve clear information. And oftentimes community partners may not have a lot of experience doing research. And so the clarity really does help to set those expectations and ensure that everyone is on the same page. And of course, not all engagement is partnership. And if we want authentic research partnerships, we got to really focus on building those. The foundational, relationship building, trust building, shared decision making, shared power, shared resources, all the things that you see in many of the community engagement frameworks. And so a little bit about why partnership actually matters. And so we think about the funding landscape. So funders, of course, are increasingly requiring authentic partnerships and proof of partnership. And in fact, in some cases, I can think of a recent application, the proof of partnership piece was longer than the actual letter of intent for a particular funder. And so this is an increasing demand from funders that you definitely can demonstrate that you have true partnership. And obviously, folks on the academic side recognize the benefit of partnering with communities to conduct research. Communities are increasingly requiring more accountability. We've heard over the years, oftentimes researchers come into our communities and gather data. We work with them to help them recruit research participants, and then we never hear back. We never learn about the outcomes. We don't really receive any benefit. And particular communities in Philadelphia, West Philadelphia, and Southwest Philadelphia are adjacent to a few academic institutions which conduct research, and you'd be surprised at how many times they're called upon to participate in one fashion or another in some research. So, and then investigators do desire to partner with communities in research. And I find this more and more folks across Penn and all sorts of institutions. This is the direction that folks are going in. It just enriches things. And early investigators and tenured faculty are oftentimes unsure about how to find and cultivate the relationships that they need to really build these meaningful partnerships and successful projects. So we know that many underserved populations, thinking about racial, social, financial, religious, and gender minorities in particular, don't really have the access to the research infrastructure and the training, and oftentimes have really been left out of the research process. And there's also an underrepresentation of these groups as research partners, and in many cases, particularly in clinical trials, as research subjects. So we know that research that does not include people with lived experience is less impactful, is less relevant, and is less translatable. And so COVID-19 was an example of these disparities. And we had a lot of social justice movements in that time, which caused like a renewed attention to these issues of racial and social inequality and health equity. And so what we came to understand and realize, and I can just say anecdotally, Sarah Solomon and I receive multiple calls just about weekly for folks who are looking for an academic or a community partner, and also from community partners who really just wanted to learn about research. And so we've built the Penn Community Scholars Program with this framing in mind and understanding that there was this need and demand for community members to build that knowledge, the skills, and the confidence to be partners in research. So the Penn Community Scholars Program was founded in 2015. A little bit of background about that. There was a program that's now the National Clinician Scholars Program, was formerly supported by the Robert Wood Johnson Foundation. So it was the RWJ Clinical Scholars Program, which myself and Lucy Touton taught the community health course for about a decade together. As the Robert Wood Johnson Foundation decided that they were going to sunset their support of the program, they offered a small amount of money to each of the four academic institutions to continue some of the community work. And so I had the idea of this training for community members around, research skills, research knowledge, and tools, which actually had, I think I started at Temple University, a community ambassadors program around 2010. So it's kind of modeled after that program. But basically, it was founded in 2015. It's geared towards leaders of community-based organizations. And we really want to build those skills so that community members are better equipped to partner and collaborate with academics and research that really has community benefit and is collaborative and transformative for everyone involved. This is a 2-semester program. We have 14 sessions, about 2 sessions per month. And there's a culminating pitch symposium. So to date, we've had 100 organizations represented in the program with 120 program alumni. This structure, it includes didactic lectures. There's hands-on sort of skill building activities during each session. We have all sorts of content experts, usually from the university, across the university and health system, come in and speak to the group on different topics. I would say about 40% maybe of the sessions are include some sort, at least 1 hour of a content expert. And then there's group facilitation, and we do all sorts of peer interactions because the co-learning, the group, cross-learning is really an important element. It is cohort based, so folks stick together the entire time. And then we do one-to-one coaching, which is a requirement for everyone who participates in the program. We start folks off thinking about like community problems, relevant problems to their organizations, work them through, going from building that problem statement into like the solution, their research questions. They think about how they might even approach a study. And they end up bringing all of their homework, all of their coursework together into a 5-minute oral pitch, or they can do a prototype or write a research proposal as their final deliverable for the class. And so this is actually a bunch of photos from our last symposium, which took place now, I think in March. And we have a panel of judges who really rate the participants. These judges represent various foundations. So Philadelphia Foundation have been longtime participants. Independence Blue Cross Foundation have participated since the beginning. Patricia Klein Foundation, a range of foundations are represented, and they are enthusiastic every year. They bring a lot of energy and a lot of the feedback for those who present pitches and prototypes. We also have 2 to 3 Penn academics who serve on the panel to really give feedback about like the feasibility of this being a research study. So this is a really exciting day each year. We have a good, attendance in terms of the audience, and the folks feel supported. We do give away monetary prizes to the top 3 pitches, and then the top 2 to 3 prototypes. So just a little bit about what we've learned from this program. We set out to impact the knowledge, skills, confidence, and beliefs about research in particular. So for knowledge, for example, we've asked questions around their knowledge and confidence related to developing specific aims, research questions, data collection approaches, understanding the IRB, how to partner with an academic, how to create a logic model, which is one of the skills that they build during the program. And then on the attitudes and belief sides, we ask about the importance of research, their desire to partner, how much they trust that a research partnership can help support their organizational mission, and distrust in the process itself. And so what we did see on a Likert scale, a 5-point Likert scale, at the start, on average, there was an increase in knowledge from 2.62 to 4.15 over the course of the program. And then you can see for confidence from 2.88 to 4.16, and then 3.58 to 4.38. And these are obviously self-reported. So again, just thinking about the impact, we have seen 30 plus subsequent collaborations with Penn faculty members. And this would include grant proposals, programming, service on community advisory board, and also some student experiences. There have been 21 funded projects from the NIH and PCORI to state and local funding sources, and some of the internal Penn funding mechanisms as well. And then from foundations that have been around the table. And I will also say that we've seen during that symposium, funders actually write checks in that moment to support the work. Even though that's not the role that they're playing, we've seen them be so moved by some of these pitches that they just confirmed that they wanted to support it in that moment, which has been an awesome outcome for folks. And it's very difficult, as you know, to get in front of a panel of funders. So we're really excited that we've had their support for so many years. And some of the organizations, their symbols, logos are listed here, but this is really on the right-hand side, a depiction just to show you the size of organizations that have been a part of the program. So it ranges, and most of them are smaller, more grassroots organizations, but we have had a range in terms of size. So we have this trained cadre of community members who are ready and anxious to partner, and we want to make sure that they have the right partners. They are ready to partner. We have academics who are looking for partners. And so what we thought would be really important is to build upon the success of the Penn Community Scholars Program to really create an infrastructure to help make those connections within the institution between academics and community members who were interested in partners to help make it easier for them to find one another and to build those connections, but not just find one another, for us to help cultivate that relationship building if needed. So this is REACH, Research and Engagement in Academic Community Partnerships for Health. And this is the accessible university-wide resource. And it's actually open to others. We have other folks who have joined the network, but to foster meaningful community academic connections. So the way we went about building REACH, we knew, of course, we are getting requests for folks looking for partners, or folks looking for community advisory board members. We have a trained group of community members who really want to get involved in research. And so we thought that this was the natural next step. But to build it, we wanted to be sure that we're building something that people would want. And we wanted to include components that would be most valuable for researchers on the academic side and community members. So to start, we went through a process of learning, which started with interviews. We interviewed 25 individuals, about half and half on the academic and community side. We conducted 3 focus groups. One was with all academics, one was with all community scholars or alumni, and then there were another group that consisted of community members who were not a part of the Community Scholars Program. We conducted surveys asking a wide range of questions, and we used what we learned to really create this platform, which is this website design, which is the REACH platform, where it's essentially a online community and platform resource for individuals who are looking for partners and information about community academic partnerships. So we designed the platform, and then we did a round of user testing. I actually think we did 2 to 3 rounds of user testing and ended up with the final platform. And so this is a screenshot of the Connect collaborator networking platform, which is, I would say, like the central hub for the REACH platform. And this is where, similar to like LinkedIn, where an academic or community member could go on, create a profile, enter, their background information, share videos, publications, you name it, for their profile. And then you could go on and search by, let's say someone's interested in diabetes research. You would put that in, and anyone who's in that database would pop up. And you can start to make the connection that way. But the connection doesn't just happen because someone's name was populated. In the background, we're there to facilitate those connections. So we're alerted that someone would like to make a connection, and then we try to help facilitate those connections and build that relationship along the way. So that's one key part of it. Then there's a resource library that's available there. And we're constantly looking for new resources to put in. So if you have anything, we're happy to, include them. And then we also offer individual and partner coaching. So it could be for an academic, or it could be for a community member, or for a coalition or a group of people who are already working together. And then you'll see the information about the Penn Community Scholars program in there. And a newer initiative is this Reach Community Coalition, which really is bringing together a group of community members, mostly former scholars, to help build and support research agendas along with academics. So if an academic reaches out, we'll be able to tap into that stronger network, which individuals will receive additional capacity building to really make those connections with people who are ready to move forward. And our website, in case you're interested, is reachpenn.com. So overall, Reach makes the partnerships easier, more efficient, and more effective. And so this is another sort of like outcomes-based slide, really talking a little bit about how we have supported the work of academic and community members. So some of the community scholars have grown their pilot studies, which they started the foundation for within the program, to $1 million plus grants. There's some examples there: Lutheran Settlement House, Nature PHL, which was formerly Nature RX, Young Chances Foundation, and Achievability. The community partners feel prepared for research. We hear this over and over again. And they actually are utilizing the skills. Some have actually built out research sort of units within their nonprofit organizations. As an example, here's a quote: "They give you the tools, the knowledge, and the language. So when you start talking to an academic partner, you say to yourself, oh, I know what that is. And oh, I've done that before." You feel prepared. Reach also gives partners a starting place. A lot of times folks just don't know how to make those initial contacts, and Reach is a trusted consultant and easier way to sort of find folks. And our staff, as I said, we partner with folks across the spectrum to really help build those strong partnerships. So we've translated what we've learned into a more condensed version of a community scholars program serving the improved network. As part of Amethyst, this program is supported by Amethyst, and it really focuses on bringing together folks across the country who are part of the improved network to help do that same thing, really build their capacity, their knowledge, their skills, and confidence to partner in research. Many of them are already engaged in the improved network as research partners, community advisory board members, or in some other capacity. And they bring a lot of energy and a lot of questions, I'll say, about how to even strengthen their positioning within this improved network. So it's been a wonderful experience. The first cohort, we had 3 individuals, and here's their representation on the right. They represent different organizations. And so we were really happy to learn from each of them. Similar to the Community Scholars Program, we center this around community-based participatory research, that process. And we use a 6-step model to make it simple and talk through each of those components. We talk a lot about authentic partnerships. We got so much rich information about their experiences, particularly within the improved network, and with their partners or in whatever role they're serving, and their desire to really build additional skills to support the work that they're doing at their respective sites. And they also develop a compelling pitch. Um, they have a concept paper that they've developed for this idea that we start them off with in the beginning, thinking about that problem and solution and the research questions as they're learning about the research process. And what we've been able to do through Amethyst Support is offer pilot funding to support their work. And in this improved model, we've been able to integrate more about implementation science and maternal health equity. And it's something that they've expressed even more interest in. So it does culminate in these pilot grant proposals and funding to support their ideas. And that support really includes coaching from one of us, one or more of us. So we do keep that coaching piece of it as central to their experience to make sure that, you know, we're offering the supports that they may need. So when we think about our first cohort, our next cohort will be recruiting for in the coming months. And so the first one was a condensed summer program. And the next one, we know we need to offer extended timelines. So it'll be more sessions across more months. Originally, there were group sessions with greater emphasis on individual coaching and consultation. We will continue to do those, but the peer support is also highly valued. So we want to make sure that folks are able to come together, and even how we approach their interaction is really going to be a key part of this. And we recruited in a relatively brief time period, hence having just 3 participants. But we will open applications earlier ahead of like the scheduled launch. So we'll have several months to recruit, and we're looking forward to welcoming in a new cohort. This is just kind of describing, here's a QR code that will be recruiting. And so that's the QR code for the program. That links to a site that we have built out for the Amethyst piece of this in particular. And then we, of course, continue to offer folks within the Improved Network, if they desired any individual and partner coaching, there are co-learning partnership opportunities that we'll have available in the Signature Community Scholars Program for the Improved Network. So that website specifically is reachpenn.com /improve.